professor at the University of Modena and Reggio Emilia. Most of the time I practice at Ospedale Sant'Agostino Estense in Baggiovara, that is in Modena, and I also practice in Milan at the Columbus Clinic Center. My specialty is urology, and my main topic of interest is robotic surgery. Elefant is a suction device that we use for robotic or laparoscopic procedures, and is made of a cannula and a handling part that has two main keys that can be used by the operator or the assistants. Mainly the assistant in case of robotic surgery, because we know that the operator is on the side of the patient in the console. I have been using Elefant since 2005, it means 12 years. And I came across Elefant during my first fellowship in minimally invasive surgery in Milan with Dr. Franco Gaboardi. And I was assisting him, I was keeping most of the time the suction device, the Elefant. So I started my experience with it, and I never changed because I feel very comfortable with it. So far, if I consider cases as a first operator or bedside assistant where I use the suction device personally, it's a little bit about 1,500 cases. As far as the instrument is concerned, it's pretty easy to prepare because it's just one piece. So for the scrub nurse, opens up the envelope and you're ready. So if it happens that it falls down, if you want to change it, it's pretty quick. So if we look at the instrument and you look at the tip, you have a main hole here for the suction irrigation, and also some side holes that are very useful not to have the instrument block sucking some tissue. And that is important because it's pretty easy to have the tip free when you have some tissue going inside. So you see the cannula, here is a 35 centimeters. This length, in my personal experience, is very comfortable to do the surgery for kidney. I personally, but this is personal preference, to use the 45 for the radical prostatectomy. If you look at the handle, you see that we have two main buttons. It's pretty easy to understand what is the irrigation and what is the suction. So this one is the irrigation and this one is the suction. Most of the time you have to use it as a suction, so it's good to have it in this position that is easier to get for the assistant rather than this one. And then you see the fact that the handling, you can keep the handling in your arm, you can rotate it clearly, and allows us also to make a good turning of the device when it's needed. What I think is also pretty important, when you look at the tubes in the back, the consistency is enough to have good suction and irrigation, but it's not too hard, because sometimes if you have this part too hard, it can be annoying for the assistant because they have some resistance and your movement become a little weird, not delicate as it has to be. So I think that these are the main characteristics of the device and the reason why I like it. The importance of having irrigation and suction in the same device is due to the fact that you really have a balance between suctioning and visioning, not reducing the pressure of the cavity, because particularly when there is some bleeding, you need to see, and you don't have to have a reduction of the pressure. Particularly, as an example, when you are doing the sectioning of the dorsal vein complex of the DVC in the robotic prostatectomy, it can happen that you have some bleeding, and sometimes flushing the tissue allows us to see without reducing the pressure of the abdominal cavity. So this is why we want to sometimes have some flush, sometimes to have some suctioning in order to see better the tissue we have to deal with. The rigidity of the cannula is really a key of the device. The reason is that you use a suction device for suctioning and irrigation, but most of the time you use it also to retract some tissue, to lift the tissue. And in my personal experience is the key instrument to develop the space between the seminal vesicle and when I want to find the right spot in the dissection of the prostate from the adenovias fascia, or when I want to keep the adenovias fascia in place. Another spot that for me is absolutely important is when I have to make the retrograde nerve sparing again in the robotic prostatectomy. With the left robotic arm, I retract the prostate, and with the other two, I try to dissect, to peel the bundle of the prostate. And when you start developing the space, it's important to have at the base of the triangle that you really see between prostate bundle, to keep the suction device, the Elefant, and to make a very gentle retraction and suctioning. About the handling of the device, as a robotic surgeon who has been for a long time assistant, as a bedside assistant, the handling and the ergonomy is critical, and I would say that it's more critical than for laparoscopy. The reason is that the surgical field, the belly of the patients, has a lot of trokers, but also the robotic arms. So it can happen that you have to keep your device between some robotic arms. So the space can be a little bit hard to find. So if you have an appropriate ergonomic handling, you don't have to put the hand too close to the robotic arms, and you have the chance to move it and to find the right positioning of the cannula. So I would say that what is one of the most important points of the Elefant, so the ergonomy of the handling, and I really need it. Well, I would say that there is no learning curve actually, because the device is very intuitive, it's easy to use, and also the pressure that you have to use to push the irrigation and the suction is very appropriate. You don't have to push too much, so you don't have the risk of having a vibration of the tip of the cannula. It's pretty light, and you don't have to put your hand in a weird way to use it appropriately. So I would say they can use it straightforward. The only thing that you have to learn is what is the left button doing and what is the right button doing. So this is something that you just take 5 minutes. I would recommend the Elefant as a suction device because of the quality of the device, particularly I would say when you have a hard situation, you have some important bleeding, it's pretty hard to have the cannula that is blocked by clots. It's working very appropriately. It's very good for that. It's very dependable, particularly when the situation is difficult to deal with. If I have 3 words to define this device, I would say that is a very dependable instrument, is very effective, and it's also very nice.